Yeah, really, Karetfort group is situated in Ogongo village. And Ogongo village is a large village where it is just like, it is very, very interior, deeply rooted in very remote. And the nearest health center is about 17 kilometers away from where they are. And so it is really a big challenge. I know Karetfort Women Group has a group that has been addressing issues to do with the HIV/AIDS.
If you've got a child that's sick, how do you get to the nearest health?
They normally walk because they don't have money to board a vehicle or a motorcycle. So they normally walk.
Community.
Yes, the need of this community that the people here needs health care and they live very far from the hospital area. And this hospital will help them. They come for delivery, ARV care services, and even immunization for their young children they will come here to get.
Actually, immunization is something that is very, very important, and really, because if you want to immunize children, you have to travel 17 kilometers away to get immunization, really. So this will also help a lot.
And what are the most significant health problems in this region?
Tuo mar ayaki,
HIV/AIDS infection,
cholera, malaria.
We have been having high death rate because of the distance from the hospital. So normally there's high death rate on children. So if we get the hospital, maybe the death rate will reduce.
Yes, this place will be for the antenatal care, because we will refer them to PMTC where they will get services for a HIV test, and they will deliver very near to the close place. Then they will be given, the children born here will be given ARVs to start them on if the child is positive. It is a big problem because they walk very far, because if they are diagnosed, they walk a very far distance to the health facility to get the services. Mm-hmm. But when this one will be put in place, they will get to the nearest place.
Is there a pretty high incidence of HIV here?
Yes, there is high incidence because, just as we talked, this area is a gold mining area. And gold mining came with the issues of many sexual relations, and HIV is really a real problem in this area because of the mining, the kind of economic activity.
Okay.
Yes, and then they engage in sexual activities.
Yeah.
Some also don't have money and they think that's a way of getting money.
Yeah.
Yes.
Okay. Right. Yes, that's what they will do. They will offer and they will supply and give the ARVs to the clients who are on ARVs.
Yes, Karetfort Women Group is already helping orphans and vulnerable children, and currently we have enrolled 289 OVCs in 76 households.
With them.
The children receive support, the social support, that is food, clothing, and shelter. Shelter is going to the whole family. Then the children also receive educational support, school fee, uniform, and nursery school levies.
And textbook.
And textbooks. Okay.
To such. And really, the children, with support from Stephen Lewis Foundation, the children that they support, the people living with HIV/AIDS that they support, like they have like a medical bill for them. But whenever they want to refer them to hospital, they have to trek 17 kilometers away. Some end up even dying before they reach hospital anyway, because 17 kilometers, there is no vehicle, the road is rough, and the distance too long. And majorly this has been experienced in situations of deliveries. You find otherwise they will go for the traditional birth attendants who have very little skills, and also is not safe and secure because of they don't have the right equipment to do that anyway. And really has led to a lot of challenges in terms of death, in terms of serious problems. The dispensary will help like to also provide like first aid, will help in cases of deliveries of women, will also help us to organize for ARVs, antiretroviral drugs, ARVs.
On the issue of staffing, Karetfort the Women Group is already working with Stephen Lewis Foundation in Canada, and they've employed a project nurse and community health workers. And through collaboration with the Ministry of Health, we'll get secondment of our staff.
This is the place the CanAssist giving us to put up a building with dispensary at Caredford. This one we'll use for children and mothers and outpatient people who will come to get some services from us.
And I'm very grateful to the CanAssist organization for funding the organization and helping build the dispensary.